So we have courses that we talked about regarding what we have to offer people who are looking at getting involved with coding. And let's talk about the physician-based medical coding course.
Well, that's kind of the main full course that CCO offers. We have so many great courses. We have the Blitz program and everything, but the physician-based coding course is I want to say it's the core. Yes, that's the word I'm trying to think of. This is what you need under your belt to get started, whether you are a new coder or you've been coding for a while, because you want to pick up that credential, and you may be the best coder in your office, and yet you may not have the skills to take the test properly, to pass that certification. We can help you with that. We can hone and fine-tune the guidelines that you need to go over, and just give you confidence.
How long does it take to get certified as a medical coder? Alicia?
I would say that our course, the physician-based coding course, is a standard 4 months. Some people take a little bit longer, and some people do it quicker than that. It really is based on your personal life. Are you working full time? Do you have children at home? What are your commitments? And so standard, we'd say 4 months.
Yeah, I always say 4 to 6 months.
Right, 4 to 6 is better.
I want to talk a little bit about what happens if somebody doesn't finish the course. We have some kind of special things that we do in coding certification. You want to talk about that, Lorraine?
If they don't finish?
And within those 4 to 6 months.
Oh, sure, yeah. We really believe that we all have good intentions to finish the program, but sometimes life interrupts. And especially, I would say 75% of our enrollees are women, and they tend to have a lot of responsibility with family and running a household. So they tend to sometimes push themselves to the back burner. So that's why we adopt a coaching concept. So rather than someone enrolling and it's an at-your-own-pace course and we're like, okay, good luck, we actually view ourselves almost like a coach at the gym. And we'll make sure that you are, from your orientation, we work with you to find out what's your goal date. Do you want to be done in 4 months? Let's get the calendar out. Let's pick a date. Let's see what exams are around that time. And now we have a target. Of course, we can change it, but if you have a target with your coach, then you're kind of in it together. And then we say, okay, then where's the midpoint? Well, that's when you should be doing your midterm. And we back into that. And the coach will touch base with you. If they haven't heard from you in a week or two, then they're going to reach out to you and say, now remember those goals you set? What can I do to help you? What's going on that's holding you back? Let's put it back on the front burner for you. And that seems to work very well. And our students really appreciate that. They don't feel like they're just, left to their own devices. We really want them to cross that finish line.
And Alicia, as the Director of Education, you deal a lot with the students. Do you have anything to add there?
I think one of the other points is that we give you access to your content for a year. You don't have to we say 4 to 6 months, but if it's 7 months out, you don't have to pay an additional fee. You have that year. So even after you've gone through the course and say right before you want to test, you can go back and do a little practice. Your coach is your coach for that year. And we also offer the service of, if you're the practice exams, if you want to go over something with your coach, they'll be willing to do that for you as well. So once we have a student, we really don't like to let go of them. We like to keep track of you, and as well as see how you do in the future with your career.
The Physician-Based Medical Coding Course, PMCC Edition. CodingCertification.org, an AAPC education provider. Get more information below.